Hey everyone, welcome to this explainer. I am absolutely thrilled you're tuning in today because we have a very specific, incredibly important goal: ensuring your medication goes straight into your lungs, which is where it works best. Today, we're going to master the proper technique for using a metered dose inhaler, often just called an MDI.
Now, you might be looking at this question and thinking, well, obviously, right? But actually, the stakes are surprisingly high here. If you don't use the perfectly correct technique, your medicine often ends up just hitting the back of your throat instead of traveling deep down into your airways where you actually need it. It's kind of like watering a plant but only spraying the leaves instead of the roots. We absolutely want to fix that today.
Okay, let's dive into this. Here is our agenda for today. First, maximizing your medication. Second, the 6 essential steps. Third, expert tips and spacers. And fourth, maintenance and cleaning. All right, Section 1, maximizing your medication, setting up for success.
Moving right along to Section 2, the 6 essential steps. This is your core technique for proper inhalation.
So, step 1, prepare and shake. First things first, pop off that cap. You always want to do a quick check inside the mouthpiece just to make sure it's totally clear of any lint or pocket debris. Then, hold the inhaler upright. Holding it straight up like this is absolutely crucial because it actually preps the chemical suspension inside the canister.
And once it's upright, give it a really good shake. And I don't just mean a tiny, half-hearted rattle. You've got to shake this thing vigorously for exactly 5 seconds. Think of it like shaking up a salad dressing. You really need to mix that medication with the propellant inside so you get a perfect, consistent dose every single time.
All right, step 2, exhale completely. Go ahead and sit or stand up nice and straight. This opens up your diaphragm. Now, turn your head away from the inhaler and just breathe out fully through your mouth. Keep going until your lungs literally feel completely empty. Why go to all that trouble? Well, exhaling completely creates the absolute maximum amount of real estate in your lungs for the medicine to enter. You've got to make space for the good stuff.
Moving to step 3, position the mouthpiece. You want to place the mouthpiece directly into your mouth, right between your teeth. Here's a pro tip. Make sure you keep your tongue flat underneath it. Actually, a lot of people accidentally block the opening with their tongue, so just be mindful of that. Finally, clamp your lips down tight around the plastic. You're going for a really firm, airtight seal here, so no airflow escapes.
Okay, step 4, actuate and inhale slowly. This is the big one. Coordination is totally critical here. I want you to consciously slow things down for a second. Just start breathing in nice and slow and deep, right through your mouth.
Now, right as you begin that slow inhale, press down exactly once, firmly, on the top of the canister, and just keep breathing in smoothly for about 3 to 5 seconds. Timing is everything here. Pressing the canister exactly as you start to inhale ensures that the aerosol actually travels inward with your breath. It basically rides the air current deep into your lungs, rather than just uselessly splashing onto the roof of your mouth.
Step 5, hold your breath. Go ahead and take the inhaler out of your mouth and close your lips tight. We're holding our breath here because it gives those tiny, microscopic aerosol particles the time they actually need to settle downward. We want them sinking deep into the smallest branches of your airways. So how long should you hold it? You really want to aim for 10 seconds. Hold that breath for 10 full seconds, or, for just as long as is safely comfortable for you before you finally release it. And bringing it home with step 6, exhale gently and cap the device. Breathe out slowly and gently, and just make sure you're facing away from the inhaler when you do this. And then, don't forget this part, immediately pop that protective cap back over the mouthpiece. Gotta keep it safe and clean for the next time you need it. And this brilliantly illustrates how the whole sequence comes together into one seamless routine. 1. Prepare and shake for 5 seconds. 2. Exhale completely. 3. Position the mouthpiece with a super tight seal. 4. Actuate and inhale smoothly. 5. Hold your breath for 10 seconds. And 6. Exhale and cap. Honestly, once you practice this a few times, it just becomes muscle memory. A completely flawless routine for maximum benefit.
All right, moving to Section 3, expert tips and spacers. This is all about leveling up your clinical technique. Now, what's really interesting about this slide is this piece of equipment right here. If you struggle with the timing back in step 4, trying to press and breathe at the exact same split second, a spacer device or valved holding chamber is a total game changer. It literally holds the medicine in a little chamber after you press it. That completely removes the need for precise hand-breath coordination and significantly boosts how much medication actually makes it to your lungs. It takes all the pressure off.
Let's look at a few specific clinical scenarios because these are super common. First off, if you're using a corticosteroid inhaler, like fluticasone for example, you absolutely must swish and spit with water after your final puff, and never ever swallow that water. This specific rinse is crucial because it prevents oral thrush, which is a nasty little fungal infection, as well as hoarseness. Next up, if your doctor prescribed 2 puffs, don't just rapid fire them back to back. Give it a beat. Wait 1 full minute between finishing step 6 and starting all over at step 1. And finally, if your inhaler is brand spanking new, or if it just hasn't been used in a few days, you need to prime it. Just spray 2 to 4 test puffs into the air, completely away from your face, just to get the whole mechanism primed and ready to go.
Which brings us to our final section, Section 4, Maintenance and Cleaning, keeping your device reliable.
So here is your weekly cleaning routine. It's really simple. First, pull the metal canister out of the plastic casing. Now pay close attention to this part. The metal canister itself does not get washed. Keep that away from the sink. You only want to rinse the plastic mouthpiece, and you do that under warm running water. Once it's nicely rinsed, let it air dry completely. Seriously, don't try to jam a towel in there. Just let it air dry naturally before you put the whole shebang back together.
Well, we've covered the mechanics, the timing, the pro tips, and the cleaning. So I'll leave you with this thought. Your medication can only do its job if you do yours. Are you ready to take control of your respiratory health and make every single breath count? Practice this 6-step sequence today, and I promise you'll feel the difference. Thank you so much for joining me for this explainer, and I'll catch you next time.